Hello, wonderful people. How is everyone doing? Hi. I am so excited to come your way again in this video. So it's been a while since I uploaded a YouTube video, and just because I have been busy and maybe I've been doing too much TikTok. Yes, so the same handle, just Abby Aaron. Just please go follow me on TikTok as well. TikTok is so much fun. Yes, I know. So today I'm going to talk about some tips for new grad nurses. So the last couple of weeks I have had two of my friends graduate nursing school and also pass their NCLEX. So let me take this opportunity to say congratulations to Odine and Jemima. Congrats and welcome to the workforce. And also congratulations to everyone who's graduated nursing school and has also written their NCLEX and passed. If you've not passed, please do not lose hope. Keep pushing, keep studying, learning your content, which is very important, and learning how to answer questions. So thank you to my new subscribers. If you're new here, my name is Abby. I'm a nurse administrator and also a clinical educator. So this is my channel. It's all about nursing and family. So welcome to the family. Please subscribe, turn on your notifications, and let us all have fun together. So let's get right into why we're here and why you're watching me. Tips for new grads. New nurses come on the field every time, and after writing your NCLEX and passing and everything, you're kind of like nervous on what to do and like how to go about your business. So this is the right time when I feel like I need to share some things that worked for me and maybe it will possibly help other people. So as a new grad, my first thing that I was told by my nurses on the unit was to just soak it in, chill and relax, and just for me to realize that I am a new nurse. I just graduated, I did it, I beat NCLEX, so that's exciting. So my advice to any new grad is relax, just calm down, get all the nerves off you. You have succeeded by coming this far. So, and all you have to do now is learning on the job and relaxing to know what you have to do. Nobody wants to work with a nurse who is tense, who is nervous, because it kind of like affects everyone when you have a nurse on the unit who is nervous and who is so anxious. And your patients can even actually feel that. And no patient wants to have a nurse who is like nervous doing skills or doing something. They kind of like see it and they also get anxious. So please relax. You've passed your NCLEX, and if you don't know anything, this is the time to learn. So do not get all tensed up about nursing care, because we are all here for you. Okay, so my first tip. Oh, that was my first tip. Okay, so this is my second tip. Okay, so my second tip is have a learning mentality. Your mindset should be about learning. In this field, we learn new things. We learn things that we have to change. So having a learning mindset will help you, and also not being arrogant. Whatever your preceptor or whatever your seasoned nurses tell you, and if you have questions, you should ask. But whatever they tell you, please be humble enough to listen and make changes, because what you might think you're doing the right thing, but your seasoned nurses will see something wrong and will let you know. Yes. And my next one is time management. Time management is kind of tricky, and the reason why I say that is as a new nurse, you kind of like struggle between the most important things and the less important things. Everything is important, but you knowing what to do at every step in time kind of helps with your time management. And it also goes a long way if you can delegate. So delegation helps in time management. Don't beat yourself up if you're not able to manage your time efficiently. It comes with time and experience. So the more you do this, you go about your routine, the more you keep doing the same stuff, you kind of learn that, oh, this is what I can do to help me go faster. Because every patient deserves your time, but it depends on how you manage it so that you can be there for everyone and patient can feel your presence whilst you're in the room. So my other thing will be asking questions. This business and this job in nursing, you always have to ask questions. And it doesn't matter if you've been a nurse for 10 years, it doesn't matter if you've been a nurse for a month. Keep asking questions. When you have your doubts, when you don't know how to do something, ask questions. Because whenever you stop asking questions, that is when you're going downhill. You are going to get in trouble if you don't ask questions. Always clarify. Always clarify in everything that you do in nursing field. Always clarify if you're not sure. And that will take you a long way. Do not be afraid. It's like, oh, I didn't want them to feel like I did not know. No, you don't do that. You have to ask questions and know the right way to do everything that you do. Because if you don't do that, it will come back at you. So please, please, please ask questions. No question is a stupid question. Don't think that, this question, it doesn't make, I don't want someone to feel like I'm stupid. Nope. Don't do that. Don't do it. Ask questions and it will go a long way in helping you. My other thing is, it is very important. We all know that patient care is very important and charting is always important. And we are told to chart in real time. So you do your task, you chart. You do your time, you do your task, you chart. And if you didn't do it, don't chart it. If you chart it, you have to, if you did that task, you have to chart it. Charting is the only way for the shift before, after you, or the even managers to know that you really did that task. So charting is important. But how do you combine that with patient care? I would tell you that making sure that you're doing your patient care is also very important. So make sure that you do your patient care, you take care of your patients, and then do your charting. Do not be consumed by, I want to chart, I want to catch up, and not do your patient care. So let's say you have a medication due at 11 p.m. and you haven't charted and you want to keep up with your charting, but there's a medication due at 11 p.m. Do your pass your meds and then go sit down, have time and do your charting. Do not say that, okay, I am not going to pass the meds right now. I am going to finish with all my charting before I give that antibiotics. You are delaying patient care. If a patient, your call light goes off and the patient needs to be cleaned up, you cannot say, I am charting, so I'm not going to do my patient care. My patient should sit in the urine or sit in the poop for you to finish your charting. You don't do that. Patient care comes first. So please, new nurses, please do not be consumed by the charting world, which is also important, but please try as much as you can to do your patient care, then have time to do your charting. They are both important, but prioritize patient care over charting. And whenever you're done, you come right back to it and you can chart in your real time. So that is another tip that I feel like is going to help. My other tip for you will be staying organized. So right in the beginning of the shift, kind of have a routine in place. So routine in place is knowing what you do every hour of your shift. So it kind of helps you kind of staying organized, knowing the stuff that you have to do. So you know that, oh, 9 p.m. medications are due. When I come in, I get my report. This is my next step. After I get my report, sometimes the craziness can mess everything up and you don't go by the book. By trying as much as possible as a new grad to have a system in place, something that like you can go on and on and on and on with, kind of helps you. Because my next one is reading notes. Reading notes. Doctors, notes from doctors, notes from PT, notes from nutrition, every single note that you have, because that is what helps you become prepared for the next shift. For me personally, and I tell students, and I also tell my preceptees that anytime I don't read notes, I kind of fumble when I'm giving a report to the next shift, because I feel like I am not ready. I did not do a lot of digging about the patient. But reading notes and checking what the doctors are saying helps you with your plan of care, also helps you with which direction that they are going. So when you're passing it on to the next shifts, you actually know about your patient. And I feel like the doctors might not tell you everything that you need to know, but when you read notes, you hear from that. I work night shifts. I wouldn't be around when PT works on the patient. So when I read the note from the physical therapist, it kind of like leads me into knowing what they are planning, how PT went with the patient, how patient ambulates. You might get that through your shift report. Find your resources in every unit that you are. You know who your resources are. Finding your resources goes a long way. You know the nurses that you can count on. You know those that you cannot count on. So you find your resources and keep them. And my last thing is don't be involved in the drama. You don't need it and it won't help you. Just go to work, do your job, and go home. That is all. Go to work, do your job, and go home. So yeah, I think this is a few things that work for me, and I hope it works for you too. If you've not subscribed to my channel, kindly subscribe and join the fun. And if you have, thank you for your support. Thank you for your encouragement, and thank you for making this channel a success. I really appreciate you all.